I'm from the Department of Dermatology at Henry Ford Hospital in Detroit, Michigan. First of all, I'd like to thank Cantabria Laboratory for inviting me to participate in the session today. The topic that I'm to cover is the effects of Fernblock on photobiologic changes on the skin. Let me start by introduction of Polypodium leucotomus extract. This is a fern plant extract primarily coming from Central America. It does have antioxidant and anti-inflammatory properties. There are quite a number of PLE preparations in the market. This very nice study that was done by Salvador Gonzalez, published in 2018, was a very nice one looking at 6 PLE preparations. And what he found and his group found is that Fernblock, which is the topic that I'm going to be covering today, is the most efficient among the 6 preparations photoprotector. Should be noted that Fernblock is the preparation used in all but one of the published clinical studies. In fact, all the studies that I'm going to be presenting, which is done by our group at Henry Ford in Detroit, is using Fernblock. Polypodium leucotomus extracts orally has been shown to suppress clinical changes induced by UVB, clinical changes induced by PUVA, and studies from Europe had shown it also would suppress the development of polymorphous light eruption. A recent study by Professor Go showed that it is safe and effective adjunctive therapy for melasma. He used it together with hydroquinone as well as sunscreen. Our group had done quite a bit of study looking at the effect of Fernblock on UV and visible light induced changes. And this is a topic that I'm going to be covering. Let's start with the effect of Fernblock and ultraviolet B. This is a study that published 3 years ago, looking at the effect of PLE on UVB-induced changes. We studied 22 subjects, lighter skin types, skin phototypes 1 to 3. Fernblock or Polypodium leucotomus extract at 240 milligrams was given 2 hours and 1 hour before UV radiation. So this is an acute effect of the Fernblock administration. What we found is that it would result in a decrease of UV-induced erythema, and this is shown here. On the left side is by investigator global assessment, before PLE, the red bar, and after PLE. There is a statistical significant difference in the suppression of UV-induced erythema. This was confirmed on the right-hand slide by colorimetry. So by directly measuring the color, one can see that there is also a suppression after administration of 2 doses of Fernblock. When we put all the data of the 22 patients together, this is a summary of the slide. You can see that on the horizontal axis is just the different doses of UVB that we administered to these patients, to these subjects, and this is the average erythema intensity on the vertical axis. The red dots and the red line, the line here with the red dots, indicate before PLE. You can see that as the dose increase, the erythema, of course, increase. But most importantly, after PLE, the green dots here, you could see for all the same subjects, when it is averaged out, the ability of UV to induce erythema is suppressed. And this is statistically significant, and also should be noted, this is assessed by colorimeter. Therefore, what is happening here is that there is a shift of the skin phototype from a lighter to a darker skin phototype with Fernblock. Aside from that, aside from the erythema, we look at markers of DNA damage, apoptosis, inflammation, and proliferation. And we found that these 2 doses of PLE result in inhibition of these markers. Therefore, it has a very broad photoprotective effect. This is shown here On the left-hand side, the sunburn cell, normal control before PLE, and after PLE, you can see there's a significant suppression of the sunburn cell, and same thing in terms of intensity for COX-2 staining. This is before PLE, after UVB irradiation. After PLE, significantly less intensity in the staining, indicating that inflammation is also suppressed by Fernblock. So that is the effect of UV. How about visible light? Let's go over the effect of visible light on the skin. Then we'll go over about the effect of Fernblock on visible light-induced changes. This is a depiction of the solar irradiation as it reaches the Earth's surface. Should be noted that visible light consists of 50% of the sunlight at the sea level. Therefore, it's a very significant portion of sunlight that we are exposed to. Obviously, visible light is visible to human skin. The wavelength is between 400 to 700 nanometer. Visible light clearly is very important for life. We all need visible light to be able to enjoy the beauty that the Earth has given us, including the very beautiful gardens in Suzhou, as you can see on the left-hand side. However, for the longest time, visible light has been regarded to be without significant photobiologic effect on the skin. Our group was among the first one that showed that is not the case. This slide summarizes the finding that visible light with a very small amount of UVA1, which is the longest spectrum of UVA, would induce biologic effects on the skin. First, in dark-skinned individuals, it would induce pigmentation. Let me show you the results of the study. This is exposure to UVA1. You could see that there is immediate pigment darkening, and then by 1 week, the pigment darkening has pretty much resolved, except at the very high dose of the UVA1. At the equivalent doses of visible light, which is consisting of 70 minutes of sun exposure, you could see that the intensity of visible light-induced pigmentation immediately after was significantly more intense as compared to UVA1-induced changes. And then this also would persist up to 1 week at a much more noticeable degree as compared to UVA1-induced changes. Should be noted that these changes is specifically for individuals with darker skin type. This particular slide shows that for individual skin type 2, the same doses of visible light did not induce any pigmentary alteration. Clearly, this is very important for those of us who are of skin of color, who are immunocompetent in being able to tan. Furthermore, we have looked at also the synergistic effect of visible light and UVA1. This we are looking at 10 subjects for darker skin type between 4 to 6. And then you can, using visible light in the presence or absence of UVA1, which is the longest spectrum of UVA, as I've mentioned before. This slide is a rather busy slide, but the summary here is actually on the left panel is the UVA1 plus visible light with UVA1. On the right panel is pure visible light, but you can see across the board at different time point, at different doses, the visible light plus UVA1 induced pigmentary alteration is significantly more as compared to visible light alone. Compare, for example, this row versus this row, and you can see that the small amount of UVA1 would enhance the effect of visible light. Aside from pigmentation, what we have found also in light-skinned individual, in contrast to dark-skinned individual, in light-skinned individual, there is also development of immediate erythema. This is shown here. This was published in 2019. You can see that immediately after exposure to visible light, there is erythema on the skin. In the lighter skin individual, then this is the average score when we average out all the number of subjects that was studied in this particular experiment. In addition to visual evaluation, we did a colorimetric measurement on the right, and we used DRS measurement on the correction on the left and DRS measurement on the right, you can see on both objective measurements, there is also the development of erythema immediately after exposure, which subsided by 24 hours and of course by 7 days. Same thing over here. The conclusion from this study, the fact that visible light can induce redness, indeed is a very novel finding, because up to now, the thought is that the erythemogenic spectrum of sunlight is primarily UVB and short wavelength UVA, specifically UVA2, which is between 320 to 340. So we're showing here that visible light also can induce erythema on the light-skinned individual. What are the clinical implications of this finding, pigmentations and erythema of induced by visible light? These results may contribute to conditions that cause pigmentary alterations on the skin that we all see among our skin of color patients, including, of course, the patients in China. Melasma, post-inflammatory hyperpigmentation. This goes along with, I think, with our clinical findings that many of these patients, they would tell us, even though they're using sunscreen, somehow their melasma, their post-inflammatory hyperpigmentation continue to get worse. So that is the reason I think there is a contribution of visible light for these changes. Then the other important implication is that the regular sunscreen, the organic or chemical sunscreens, they are designed to protect against UV, but they do not protect against visible light. Therefore, other means of photoprotection currently are being studied. This has become a very active of research in photobiology. The clinical implications of these is that in order to protect against the visible light, other type of sunscreen should be used, and specifically tinted sunscreen. There have been now quite a number of publications that show that tinted sunscreen that contain iron oxide would be beneficial in down-regulating the effect of visible light on melasma, as well as on hyperpigmentation. Furthermore, there are now companies that are developing new generation of filters that cover long UVA and visible light region. Clearly, by definition, these filters are going to be pigmented, so they have to be produced in such a way that would be acceptable to the general public. Currently, they are not in the market yet, but nonetheless, active research is done on that particular area. Lastly, we know that visible light would induce reactive oxygen species generation. Therefore, antioxidants might also be beneficial. This is when polypodium leukotomus or Fernblock comes in. Let's take a look at the effect of polypodium leukotomus and visible light. This is a study that we published in December of 2019, looking at the effect of polypodium leukotomus extract and its impact on visible light-induced pigmentation. Let me go over the study protocol. 22 subjects, darker skin type between 4 to 6. Patients were given PLE, 240 milligrams, 2 tablets daily for a total of 28 days. We did assessment before the PLE administration and after 28 days of PLE, looking specifically at immediate pigment darkening, persistent pigment darkening, and delayed tanning on day number 7. This is the method. On day 0, patients were irradiated with visible light. We assessed the immediate pigment darkening. Day 1, we assessed the persistent pigment darkening. And day 7, we assessed the delayed tanning. And then at that time, that's when we start giving patients the 28-day supply of polypodium leukotomus extract. After 28 days, similar procedure is done, namely irradiation with visible light, and then assessments were done for pigmentary alterations. Let me show you the methods that we use. Assessment include close polarized photography, investigators' global assessment, diffuse reflectance spectroscopy, as well as histologic evaluation. This is one of the representative results. This is in the same patient before PLE and after PLE. You could see that before PLE, And after PLE, there is a significant difference in terms of pigmentary alteration in this individual across all the time-blind study. When we summarize this data, especially using the more objective measurement of diffuse refractance spectroscopy, you could see the difference here. The pre-PLE is shown in red, the post-PLE is shown in green. You could see on day 1, which is the time that you can measure persistent pigment darkening, there is a statistically significant difference between pre and post-PLE. Likewise, on day 7, which is right here, this is when we measure the delayed tanning, there is also a statistically significant difference between pre and post results. Furthermore, we also found that there is a decrease in the following stain after PLE in the first 20 subjects. That is, 8-oxoguanine was suppressed. It indicates DNA damage. There's a decrease in the DNA damage staining for it also. And then there's a decrease in COX-2 staining, which is indicating a decrease in the inflammatory response that we see in these patients. Furthermore, we look at also other parameters, including the MMPs, matrix metalloproteinases, which we know it is associated with photoaging. Let me highlight the results. You can see that pre compared to post-PLE for MMP2 and MMP9, there is a suppression, even though it did not reach the statistical significance, but there is a trend of suppression of the matrix metalloproteinases, which we know it is associated with photoaging. Furthermore, we also found that when we look at the markers of apoptosis, which is BCL2, and there is also a suppression, again, did not reach statistical significance right over here. However, it did show there is a trend of suppression caused by the Fernblock. So conclusion from these is that PLE, Fernblock specifically, has potential as a photoprotective agent in visible light-induced pigmentary alteration. How about for extrinsic aging? We do know that in order to prevent that, exposure to sunlight should be minimized because it is an important component of photoaging. We also know that sunscreens, by providing protections against UV irradiation, is protective against photoaging. But these results shown previously by us show that PLE Fernblock specifically, by downregulating UV and visible light-induced changes, has the potential to serve as an adjunct in photoprotection. As we look at this very beautiful sunrise in Huangshan, I would like to thank you all very much for listening.